members. So with that, the question is, well, how do you find these providers? How do you integrate it into the primary care or whatever services you're offering? And so this session is on integrating behavioral health services into your EAP and primary care services. And with that, we have three excellent ladies who will be, who are well in their expertise and their knowledge, and will provide you with a lot of great information. So we have Carly Deer, Director of Mental Health Strategy for Lyra Health, Brita Rierson, Senior Medical Director for the Well and Optum Every Care, and Dr. Martha Shepard, Medical Director of Vanderbilt Health and Metro National Schools. So with that, I'll turn it over to Carly. Thank you very much.
How's everybody doing? Do we need a quick energizing stand up, sit down? Are we doing all right? Okay, good. So we're here to talk about how you can integrate behavioral health into your primary care center. I'm going to first start, as I flip through there, talking about how you transform a culture, because you need to transform your culture to get people comfortable talking about mental health before you can actually get them to seek behavioral health services. So like Larry mentioned, I'm with Lyra Health, which is a comprehensive mental health solution. Think of it as EAP on steroids. We do the full scope of mental health services. So just a little disclaimer there. As you know, employees are burnt out, and they really need your help as employers to champion their own mental well-being. We know that 77% of employees are currently experiencing burnout, and 60% of employees have never talked about mental health at their workplace. Even though it's becoming more and more of a topic in social media, the national news, et cetera, there's still that barrier to get employees to actually talk about mental health in their day-to-day and bringing their whole self to work in the workplace. There's a few different ways you can go about embedding the concept of talking about mental health and really supporting a culture that supports mental health. It's not sending out an email. It's a little bit more strategic than that. One way is really starting the conversation. How do you have small conversations at work about mental health? When I was at Target, one of the things we did is start just hosting town halls about all the things that were happening in society. You know, that was the summer of 2020. How do we, you know, how are employees processing all the social and racial injustice? Let's have a safe space and start talking about that. At Lyra, we actually have taken that one step further. We have small groups of like 40 and their clinician-led conversations. It's really creating a safe space where it's okay to talk about things and knowing that the people in that conversation are also there to listen and share their whole selves. Another traditional way that I think a lot of people are already doing is offering workshops. So making it more of an event, like we're going to have a specific event where we're going to talk about mental health or struggling with anxiety or parenting and, you know, working. Just creating those topical events is another great way to break the ice and start talking about mental health. I think a big thing is getting your managers and leaders comfortable talking about mental health. Just because you're a manager or leader doesn't mean you all of a sudden know how to talk about mental health or feel comfortable approaching an employee if you think that they might be struggling with their mental health concern. But how do you upskill a manager and supervise their population? We know that there's mental health first aid training that's available. I don't know if any of you have taken that yourself or maybe had some of your managers or leaders do it. It's a great offering, but it's a 4 or 8 hour commitment where your people have to step away from their day job and then go do the training. And it's really a point in time offering as well. So as you're bringing new managers and leaders on board, they might have missed that opportunity. So one thing that we're doing at Lyra is we actually have an e-learning option, and it's 2 hours, and it's a condensed version of that mental health first aid training. So then as leaders come into the organization, they can take this training, do 5-minute increments of training at a time to get upskilled. And then it also has a companion piece of how you can then bring this back to your teams. So again, it's just infusing that what do I do? How do I talk to somebody about mental health? What do I do if somebody's struggling? And then how do I not play the role of counselor, but connect people to the right resources? So I think upskilling your manager population so they can start to have those conversations with their teams is key. Again, creating a culture where it's okay to talk about mental health. How many of you have employee resource groups within your organization today? Just a show of hands. Okay, great. This is another great way to start talking about mental health. And I think, a lot of ERGs are looking for ways to continue to propel their ERGs forward. Like, what do we do next topically? Mental health is a great topic to put into those ERGs and have it part of their ongoing conversations. Similarly, peer champions is another great way to continue the conversation. Not everybody's comfortable talking with their manager about mental health, but if I know that I have a peer who has identified themselves as a mental health champion, I might feel more comfortable talking to my peer about mental health. Again, back to my Target days, we had a mental health ally program. And so people would raise their hand and say, I'm okay talking about mental health. I would like to be an ally. And we would basically give them a little bit of training. They would agree that they're not going to all of a sudden be a therapist. They're not going to be prying for questions. But if a coworker reached out for support, they would connect them to the right mental health resources. So again, it's like top down, like how are managers making it okay to talk about mental health? And then coworker to coworker, how are we making it okay to talk about mental health and creating that safe space? I think another thing is making sure when a crisis happens, how do we address that as an organization? How do we talk about that? And again, I think a lot of times we just kind of hope and pray that nothing bad is ever going to happen. And then something happens either at our organization or in society, which seems like every month something else is happening. How do we communicate to our employees? What are the right things to say? And Lyra can actually help, and I'm sure your EAPs can help too. How do I communicate? What is a targeted specific communication on how we're going to handle this? And then again, how do we connect the resources? How do we make sure our employees know where to go and how to get support? And then finally is anti-stigma campaigns. And again, it's not an email. I think really successful anti-stigma campaigns share personal stories. So do you have a leader who maybe has themselves gone through a mental health struggle, or maybe has had a family member go through a mental health struggle? Or do you have somebody in one of your plants who's maybe struggled with substance abuse, who's comfortable sharing their story? Those personal stories are so powerful because all of a sudden, if you're struggling, you know you're not alone because somebody's already shared their own experience. And so if you can get those in a video or even like a little testimonial, those go so far as creating that space to make sure that everybody knows it's okay to seek mental health support. So that's kind of, the smattering of different ways. And again, it's like offering all these things. So it's not a one and done, but you continue to work your different channels to make sure that you're saying it's okay to talk about mental health. So once you start to infuse the culture, you still need to make it accessible for your employees to actually get connected to mental health care. Oh, I have one more slide. I guess I didn't go up there. With that, it's how do employees actually get connected to their mental health care? And so with Lyra, we actually have a platform. You go through an assessment, you get connected with a provider. If you have an on-site clinic, that will come up as an option when somebody wants to schedule an appointment. So then instead of trying to figure out what the number is for the therapist at the on-site clinic, you can actually schedule online in real time. Again, it's like removing those barriers to get connected to care. So you can actually go from thinking, I think I need support, to getting connected to the actual provider. I'll pass it over to Britta now.
Thanks, Carly. So I'm going to take it that one step further and talk about connection. And we've heard that term how many times this morning already? I think that's the theme of the conference this year is how do we become more connected and integrated to really deliver and offer that whole person care? All right. So there are a few questions that I hope that we'll all be able to answer after our talk today. So one is, how do we improve the access to care for our members and our employees? It's a different world. We have hybrid workers, we have fully remote workers, we have folks who have moved to Washington and they used to live in Minnesota and now they're staying there. So how do we meet their needs? And how do we really deliver a population health strategy that looks at the whole person? So not just medical, not just behavioral, but how do we loop it all together? Again, connected care models, that's the goal here. And that's what we're all trying to solution for. And then really realizing the benefit of as to why we're promoting this whole person care. Why is primary care at the focus and the hub? And how are we looking at all those aspects together? So definitely not my pitch at all about Optum Every Care Primary, but really that has been our solution to how we're going to bring this all together. So it's modern, it's convenient, it has multiple access points with one single entry door. And it's that virtual care, that virtual urgent care, primary care, behavioral health, access to in-person touch points with community network providers, trusted partners, other urgent care centers that we trust and know they're doing a good job. And then more importantly, the employer-sponsored on-site, near-site, the student health centers, all of these can operate in isolation for sure. And they do an excellent job, but how do we bring all of these services together and communicate with one another to meet all the needs? Okay, so some more stats. Obviously not surprising today that behavioral health needs impact our entire healthcare system and our entire workforce. And improving access to this care is really critical in managing the whole patient. Over 25% of individuals today with a mental health concern don't get an appointment for days, if not weeks. And I would say it's likely months. I have a good friend who tried to get her daughter, college student, into a therapist and a psychiatrist in fairly high acuity concerns, 6 months before she was able to get in. She had to drop out of school. She had to go home. I mean, really, how do we connect those dots and make it more seamless? Another interesting fact is less than 20% of the behavioral health providers out there are using measurement evidence-based care. What are those 80% of providers using to measure and guide their care? Untreated behavioral health disorders cost the nation more than $100 billion annually. And then also, we know that individuals with chronic disease have higher risk for behavioral health illness. And then on the flip side, if we are managing those behavioral health needs effectively, those chronic disease conditions are going to have better outcomes. So 35 million diabetics in the country today. We know that they're 2 to 3 times more likely to suffer from depression. And unfortunately, only about a fourth to a half of them have been diagnosed or effectively treated for depression. So this is an example from Optum. In 2021, 55% of the virtual visits addressed a behavioral health concern. And this was above and beyond what they presented with. So they may have presented with a cough or a COVID question, and through that interaction, be able to evaluate a behavioral health concern as well. That's that whole person model, looking at that whole person. And then of those visits that were isolated behavioral health concerns, 66% were virtual end to end. So didn't require a high cost referral to a specialist, a wait time, really managed end to end in that virtual space. Catherine Knudsen, who is our Chief Health Officer for Optum Health Solutions, said, employers want to partner that can integrate behavioral health data, has a robust behavioral health program, rewards providers who screen for social drivers, and supports community-based resources. And these are the differentiators that drive value. We've heard all these words already this morning. So taking the next step is we, as employers, we try to get to know our population and know what those high cost drivers are, the chronic disease. And what I'd like to do is look at that population health strategy through a behavioral health lens as well. Know the workforce, know what the struggles are, use claims, referral rates, prescription costs, workman's comp, disability, presenteeism, and absenteeism, recruitment and retention. Use all that data to truly know your population and then look at the disbursement of your population. Maybe you identify some hotspots of, whoa, in Texas, we have a lot of chronic disease drivers here. And then that prepares you to address those mental health needs really across the spectrum of care, starting with your low risk. These are individuals who really have very minimal claims, but yet are we missing something there? So how are we working on that culture of removing that stigma? How are we consistently promoting resources so they know it's okay and they have something easy and seamless to connect to? Providing access to those tools that they can get on their phone and do on their own time if they're not comfortable. And then all the way to your high and moderate and high risk. And this is where maybe there's a direct recommendation to seek resources through EAP and providing that for your employees, or you have an on-site clinic, and maybe even better, you have a behavioral health resource that is dedicated to your population and integrated with your team. So this is a kind of a busy slide, but there are really 3 different models. And I remember, Carly, maybe 5 years ago at Harley-Davidson, we spoke about a co-located model. And that was, we thought that was great at Target, where EAP was co-located in our employer center. And we spoke of all the benefits that can bring. But really, we need to look at that spectrum of care. And I'm not saying that one is any better than the other again, that EAP alone or other benefits that you offer your employees is not helpful. Any tool that we have is helpful. How do we connect them? How do we connect the pieces? And then bring it to that hub, bring it to that primary care provider who knows what's going on to drive better outcomes. So you can see here across the top banner, the blue banner, you have level 1 to level 6. You can think of this banner in a couple of different ways, from low acuity illness to high acuity illness, to minimal collaboration, to very high touch collaboration, and again, low touch and high touch. And anywhere on the spectrum, you look at these 3 models. Is it coordinated? Is it co-located? Or even better, and what I would suggest is how we're seeing this practice change is integrated. Coordinated, the key there is communication. Now, I think the biggest barrier for me as a practicing primary physician is I send someone off to EAP or to the in-network therapist, and I don't know what's going on. We're both bowling down a different alley, and unfortunately, we rely on the patient to tell us what's going on. How do we make this coordinated care better? It's through communication. And even if we're not on a shared EMR, or even if we're separated by miles and miles and miles, we can do that. We can find ways to make that more effective to really drive value. Even better is the co-located. Now, in today's world, it doesn't have to be a physical space. it can be a virtual space. So that provider and from the medical, from the behavioral, they have some connection. So there's some sharing of information. They're starting to feel like a team. It's not perfect, but we are having care conferences about a patient. So it's bringing driving a little bit more value. And then even better is integrated. So here is where that behavioral health specialist is a part of the team. Our primary care team includes that behavioral health specialist. And my care, my diabetes management, my management of anxiety and depression we're managing this all together. And I would say that this is where I would love to be. I would love to practice in a situation like this because you see those outcomes over time. So what are the benefits? This whole person, physical health connected with behavioral health, this whole person care, you're getting greater transparency and clinical cohesiveness. You're pushing the envelope using different digital tools. So we're reaching our employees the way they want to be reached. We're being more proactive. We're taking a more proactive mental health approach. It's okay to talk about it. It's okay to seek care. In fact, it just comes along with the care that we provide. Faster connections, here's this accessibility, and more sophisticated risk stratification. We're looking at our population differently. Ultimately, this is going to lead to improved physical and emotional health, better health outcomes, controlled chronic disease, improved job performance, retention, productivity, less absenteeism, and then we're all looking for the VOI, the ROI. That in itself is a win-win for the employer. I was going to walk you through this journey map, and I think we have limited time, so I want to hand this over to Martha. But really, it just talks about the collaboration piece. That's the big point here. Even if we're in a virtual world, the collaboration between the behavioral health specialist and the provider, where there's that transfer of information and recommendation, can go a long way, taking that brunt work away from the patient. We're surrounding the patient with the care that they need. So with that, we're going to talk about a real world example that Martha is going to share.
Drive from over here. Can everybody hear me okay? My name's Martha Shepard. I'm a family medicine physician. I'm on faculty down the road at Vanderbilt University Medical Center, work with the Office of Population Health. And I'm going to bring together these ideas that Carly and Britta have already been talking about, creating that culture of well-being and population health strategy, and describe some of the ways we've been doing this at NNPS. And most of you here know David Hines, the Executive Benefits Director for the school district. You've heard him speak this morning. I'm very fortunate to get to work with David. He's an innovator. He's a person who's willing to think outside the box. And for me as a physician, it's been very refreshing to work with a benefits director who really understands this connection between mental and physical health. And he's been willing to invest in programs and offerings that maybe had not traditionally been covered by health insurance plans, but can make a big difference in health outcomes. I want to start out talking about our why. Everything we do is driven by a desire to take care of our community's public school teachers, and this has a trickle-down effect in the community. In 2006, David developed this mission statement with the board of the Teachers Healthcare Trust, and they wanted to look beyond healthcare costs alone to the impact of poor health on the total health and productivity paradigm, knowing that healthy employees are more productive employees. In 2009, he partnered with Vanderbilt to operate his 5 on-site medical clinics, and that combined the MNPS mission to best support the employees with Vanderbilt's mission to deliver exceptional personalized care. And that gave MNPS a trusted name and partner with a longstanding reputation of caring for our community. So today, these on-site clinics are the patient-centered medical home for over 40% of the employee population. And we work together on the shared goal of supporting all the beneficiaries who are covered under the MNPS healthcare plan. So I'll be describing the route we've taken towards mental wellness and creating this culture. And it's data-driven, it's member-informed. We have a value-based healthcare plan design with a goal of removing barriers to care like access and cost. We offer programs across the continuum of mental wellness. So from people who are barely surviving to thriving, we design things to appeal to a variety of cultures and backgrounds. We use a lot of different communications methods and awareness campaigns to reduce stigma. We have a strong integration with primary care and our extensive on-site healthcare team. And we formed partnerships in the community to support members where they live, work, worship, and play. A little bit about our population and our area. You're here in beautiful Music City. You can see all the cranes and the growing skyline around us. People are moving here from really all over the world. And we have this wonderful melting pot of diversity, but with that growth comes some challenges. The neighborhoods have become gentrified. It's expensive to live here. The infrastructures haven't fully developed to support this growth. The MNPS school district's the second largest urban school district in Tennessee, the 41st in the nation, and it's growing every day. The employees are spread across 159 work sites. They have over 88,000 students that they serve. 123 different languages are spoken in the schools, and over 76% of the students qualify as economically disadvantaged. So that's a tough setting to be working in. We know being a teacher is a baseline stressful job, and those stressors have been compounded over the last few years. They've been teaching through a pandemic. They've had national school violence. There's been a couple of tornadoes, flood. We even had a Christmas Day bombing in Nashville. So it's been a really tough time to be a teacher. The benefits coverage I'll be describing is specific for the healthcare plan that David manages. So that would be the teachers, administrators, school counselors, support staff have a different healthcare plan that's managed by Metro Nashville government. But in this certificated population, there's over 6,500 active employees. They're 79% female and have an average age of 43. But when we add in all the retirees and dependents, there's about 18,000 covered lives. And we have a data warehouse and an analyst partner. We've been working, or he's been working with the district since 2009. And he does integrate all the medical, dental, and pharmacy claims and the employee records like time off, attendance, performance evaluations. And we use this information to inform our population health strategy. One of the things the data began to show is that the younger teachers were scoring lower in mental health and well-being measures and had higher turnover than some of the more senior teachers. And we started to question, why is that? Why would our younger employees be less healthy than our older employees? And what we found is they were starting out in some of these more challenging schools and kind of running out the back door, while the older teachers were migrating to schools where some of those challenges weren't present. So we saw how stress was affecting them and their ability to take care of themselves. And we wanted to find ways to better support them. The school district has invested in social emotional learning and trauma-informed training because the social and academic outcomes of the students are at stake. But we really needed to do the same for our teachers. We needed to understand what was happening in their lives, in their homes, and the things that were affecting their ability to show up for themselves and for their students. And so these are just some of the data points that we have used to do this work. So in May of 2019, we sent out a needs assessment survey, and this was pre-COVID-19. We sent it out just to first-year teachers and teachers of the year. It was really in an attempt to get at these questions around turnover rates and how they needed to be supported. And the responses that we got brought to light a lot of the things we've talking about, issues around access. They were having a very hard time finding a therapist who was available and took insurance. You've no doubt experienced this in your community. We found there was a need to reduce stigma, and there were preferences for Christian and Spanish-speaking therapists. There were a lot of concerns about cost and time. There was a need for options for after hours access to therapists. They needed convenient locations that didn't require them to travel or get childcare. And so that ended up leading to some redesign of the healthcare plan. And in February 2022, and this was well into the pandemic, we did a population-wide wellness enhancement survey. That survey went out to all the employees and was aimed at getting data about healthcare choices, lifestyle concerns, and whole person, mind, body, spirit needs. And out of this survey came some specialized programs to meet identified needs. We had a high response rate for both surveys. Teachers have always been great about responding to surveys and not just checking the boxes. They add a lot of feedback and comments. It's like getting a paper graded. Some of the other sources of feedback and guidance are the Board of the Teachers Healthcare Trust. There's the active teachers, retirees, union reps on the board, and they're heavily involved in the healthcare plan design. And finally, for patients who utilize the clinics, we're forming a patient advisory group to be involved in co-creation of our offerings. And we regularly review and respond to feedback from our patient satisfaction surveys. We use Press Ganey as our vendor. So we're not just asking them, how are you doing? But we're asking, how are we doing supporting you? It goes both ways. And we've been surprised by some of the things we've learned. So it's very helpful to ask your members what they need and not just assume that you know. One of the first things David did in response to all this information was to remove all the behavioral health copays for providers who were in network with Cigna. That was a pretty bold move. But that did not replace EAP. So we continued to have unlimited EAP visits for the employees and their dependents. And then we partnered with a behavioral health company who's local for some program development and an app-based telehealth platform. And that essentially tripled our number of behavioral health providers who were available and were taking insurance. And it was the beginning of a new way of receiving behavioral health care. So well before COVID-19 came on the scene, the teachers and their families were already using this form of support. This graph just shows registrations from July 2019 when we first partnered with Sync. As of last month, 26% of the active employees and 12% of the employees and dependents had registered in that Sync Health and done some form of telecounseling through the app. So that's really incredible engagement. This is a platform that has been wonderful for working families. And the top 3 reasons for registration over the last 3 years consistently have been stress, anxiety, and depression. These are just 2 examples of programming that we've added to meet some of the identified needs. Educators are some of the most sleep-deprived patients I've ever had. And you know the repercussions this can have on your physical and mental health, but they really describe feeling hypervigilant during the day. They can't turn their minds off at night. And so we worked with Sync Health to host some live webinars with some sleep specialists and offer CBTI through the telehealth and through the app. And another one of our signature offerings at the Employee Wellness Center is the 8-week mindfulness-based stress reduction course. That's offered in healthcare centers worldwide. There's a lot of research around it, but it's particularly helpful for people who are in the types of jobs that they're living alongside daily stress, like first responders, educators, healthcare workers. And they want to have a healthier relationship with this stress that doesn't really go away. We see educators who complete this course developing healthier habits, and then they build skills for both the classroom and personal life. When you have a workforce that's spread over 500 square miles and almost 160 schools, it's difficult to find a time and a place to offer a wellness program. This is our communications calendar through the EAP vendor. They offer live webinars and whole person health topics. And they also have articles and webinars that can be viewed on demand. And we've also been able to provide resources that are specifically applicable to our population from some local experts through our connection with the Vanderbilt Health affiliated network. So formats like this are a good complement to a larger portfolio of offerings. They allow people to engage at their level of interest and need when it's convenient for them. This slide highlights the whole person approach we take. So lifestyle medicine is one of the most powerful, most cost-effective, and also most underutilized medicines we have. And we are aiming to improve mental health literacy, but also to target these areas of life like nutrition and exercise and job satisfaction and financial security, all these things that we know are drivers of mental wellness. Another thing we've learned is the power of group learning and social connectedness. We have focused support groups on topics like setting boundaries and compassion fatigue. We have a cohort-based 90-day men's health challenge, and we recently hosted a health fair that was for adolescents and their parents and had some opportunities for shared learning there. These types of opportunities might appeal to people who otherwise would not be seeking out behavioral health services. When it comes to mental wellness, you really can't over communicate. And we do have a communications director who helps us share information with a lot of different channels. We do use email, printed newsletters, and also have printed collateral like postcards and mailboxes, magnets, posters in schools. We've added a desktop icon to all the MNPS computers that will link them to a website containing resources. At one point, we reached a point that we developed this mental health resource guide to help both patients and providers navigate all the offerings that we had and keep them top of mind. And we were really having trouble keeping everything that we were offering straight, and which is not a bad problem to have. A lot of these things are things that as clinicians we know would help our patients. Your hands get tied by insurance constraints or lack of access to resources. Patients are concerned about out-of-pocket expense. David's been strategic about removing those barriers. So when we take care of MNPS patients, we have those resources. And then the last thing I'll say about communications, kind of the same thing that you were saying, is the most effective thing we found for reducing stigma and increasing engagement has been just with personal testimonies. Employees just sharing about positive experiences they've had or what has helped them, and they're generally very willing to do so. I've got a couple examples here. On the left is a newsletter article with a teacher telling a personal story about using the telecounseling. She says, even if you think you don't need it, you probably do. And on the right is a video clip. One of the teachers who took the MBSR course recorded this for us. It's less than a minute, but I did want to share it because her message is pretty consistent with what we hear from almost everybody taking that course. Tiny little arrow to hit. What's that? Tech support. The little arrow right there. There you go.
I took the mindfulness course in the spring of 2020, and the timing couldn't have been more perfect. The tools and skills that I learned in that course really showed me how to be comfortable sitting with myself, getting to know myself, and learning which thoughts to hold on to and which thoughts to let trickle on by. I am so thankful for it. I sought out the course because I was so stressed as a teacher and I dreaded my job every single day. But that course really helped me get through the rest of the 2020 school year. I think every single teacher that stays in the profession needs mindfulness.
She took our course right in the middle of the pandemic, and that was a special class, very supportive class. So we also have a strong emphasis on accessible primary care. The 5 on-site clinics have been placed in the county, so employees have no more than a 15-minute drive or a 15-minute wait to receive care. David talked about this heat map that we have of Nashville provided to us by Cigna. They can map where our members live. So you see over half our members are living in these peach or red shaded areas. Those are the areas of high social need, and that's where the clinics are located. You also see a picture here of our employee wellness center in Berry Hill, some of our team members. On site, there's primary care, and primary care does universal screening for depression and social determinants of health and have order sets built with resources to address those identified needs. We also have part of the team, behavioral health, chiropractic care, acupuncture, physical therapy, health coaching, a fitness center with group classes, personal trainers, a pharmacy. There's areas for group learning. There's a coffee shop, and all these services are provided at no out-of-pocket cost. So our team is very focused on working together to support physical, mental, and emotional wellness. And you'll see a lot of cross referrals across our service lines at the clinic, like PT will walk a patient down to the fitness center when they're ready to become more active, or maybe one of the fitness center reps is working with someone and send them down to the health coach for some nutrition counseling. Then on site, we have 2 behavioral health nurse practitioners. They do med management in conjunction with primary care, and we have a psychologist who does ADHD and other testing. And we have been very intentional about not just co-locating that behavioral health, but integrating them. And we do have this streamlined referral and communication system between all the service lines in behavioral health, and they can do referrals through the EMR or by warm handoffs or phone calls. And so with time, we've added tools and resources to support wellness, not just sickness, and built an environment where employees can be seen by a team that's familiar with some of their unique stressors and with their benefits offerings. Because as we've talked about, you can have, the best benefits in the world, but if your members or their healthcare team aren't familiar with them and how to promote them and access them, then they just don't get used. Last thing I'll mention is the importance of forming partnerships in the local community that can support people where they live, work, worship, and play. And this last slide just shows some of the organizations we've been able to partner with who provided support to our program one way or another. So that's the last of my comments. I think we do have time for Q&A.
So questions? Hold on a second. Is on? Yes.
I actually don't have a question. I just wanted to just kind of make a statement. And I promise Martha's not paying me for this. But one of the things I just want to mention when Martha was talking about the centers there, the wellness centers, my children, I'm a teacher, my children actually have a primary care physician, but because of the care and the one-on-one attention that they get at the wellness center, they choose not to go to their primary care doctors anymore. They want to go see Martha and her staff. Just the care that they give is just impeccable. In fact, my daughter, she's in college. She just the other day, she said, "Mom, I think I need to go to check in." And I'm like, I don't think that's a thing. Like, there's nothing wrong with you. Like, but I just want to say that the services they provide are absolutely wonderful. And being a teacher and being within 5 minutes from where my work location to be able to go work out, have my vitals taken, is just priceless.
Thank you for sharing. Thank you. So let me ask the panel, one of the key challenges in offering behavioral health is there just aren't any providers out there. So what are you doing to find providers? And everybody doesn't need a psychiatrist. How far can you go? And can you train nurses or nurse practitioners to be counselors, or what do you approach? How do you approach?
We actually find that we don't have a hard time finding providers. We actually directly employ or directly contract with all of our providers. We find providers who they provide evidence-based therapy, but they also want to be paid a fair rate, which most insurance companies don't offer. And also we make sure that we connect them to the type of patients that they want to see. A lot of therapists, it's all about access and not actually getting connected to the right type of treatment. And so by finding providers and connecting them to the right types of patients that they want to see, they want to join our network and be a part of our program.
For us, it's just been being very intentional about expanding the network locally and adding the types of therapists that patients want to have, having a Christian approach or having different race, ethnicities. Telehealth has been a wonderful thing because it has expanded that network. And so if you need something specialized, like adolescent behavioral health can be one of the hardest to find, that now they can connect to a specialist from anywhere. So that's been a big help for us.
Okay.
Right, and I would echo that as well as partnering with the expertise, finding those partners out there nationally that are doing this work. And I think just like there are a lot of primary care providers who want to come into the work site space, I think there are likely a lot of behavioral health providers who are looking for something like this. So I think it's advantageous as well. That's something else I was going to say, and now I forgot.
Okay, telehealth sometimes has had challenges crossing state lines. So if you're using an online virtual service, do behavioral health practitioners have the same challenges of working across state line if an employer's in multi-states?
Yes.
Yeah, I mean, you need to be licensed in multiple states. And I think also, though, not everybody wants to see a virtual provider. So having that in-person option is really important too.
Making sure you have that compliance team that's helping behind the scenes.
Okay. When a teacher for Nashville is referred to the hospital Vanderbilt system, is there a direct contract for imaging or reference-based pricing guarantees for orthopedic procedures?
We've been working on a number of different bundles with Vanderbilt. David's done a lot of groundbreaking work in that, but yes, we have maternity bundles. We have several orthopedic bundles, cochlear implant, medical and surgical weight loss. These bundled programs have care navigation and no out-of-pocket cost for the employee.
Okay, one of the things we've talked about is accountability and measurement. How do you measure whether you're being successful? What should an employer ask for in a performance guarantee, for example, or reporting from a behavioral health provider?
So I think guarantee around access, how quickly can your employees actually get into care? Quality, how are you actually measuring, are your employees getting better? It's one thing to get an employee into care, but if they're not getting right care, if it's not the right fit, they're going to drop out. So are they using those clinically validated measures like the PHQ-9 or the GAD-7? And then finally, employee satisfaction. How do they feel about the experience? Was just because, again, they got into a therapist who maybe is a right fit as far as what they needed to be treated for. If they didn't feel like that was the right fit, or that therapist didn't have the background that made them feel seen and heard, it's not going to be a good experience. So what was that employee experience like?
Any other questions? All right, I have one more. There are a multitude of online apps for behavioral health, mindfulness, stress reduction, anxiety. How does an on-site and near-site center integrate that information, or is it going to be separate?
I think that's the number one question. I think that's difficult, but there is having your on-site center, that team know what those resources are. That's a challenge when there are multiple. So what is that? Who is that gatekeeper? Who is then going to direct? For our on-site centers, we use our health coaches as that gatekeeper. Our providers are aware, but a lot of times they're thinking about other things. They know that they need this, but it's that health coach who tries to navigate. Same thing in the virtual space. You need that navigator to really help direct to that employer benefit portfolio.
Okay. All right. Well, please, let's thank our panelists, Carly, Martha, and Brita. Thank you.